Welcome back Sunbro. We hope you all in great health and great money. Before we start, please at least subscribe so we can have little money for food and paying bills. Alright, today we are going to talk about warning signs of a stroke you shouldn't ignore. A stroke happens when your brain suddenly stops getting blood and oxygen, often due to a blocked artery or bleeding. When this happens, brain cells can be damaged, possibly leading to disability or even death. Stroke symptoms vary depending on which part of the brain is affected, and quick action can make a huge difference. Here's how to spot the signs and respond. 1. Spotting stroke signs, the FAST test. The FAST test is an easy way to check for stroke signs. Face. Ask the person to smile. Does one side droop? Arms raise both arms. Does one drift down? Speech. Repeat a phrase. Is their speech slurred or strange? Time. If you notice any of these signs, call 911 immediately. Write down the time symptoms started. Some people use be fast, adding balance, trouble balancing, and eyes, sudden vision changes. Don't drive to the hospital. Ambulance workers can assess and start care right away. 2. Additional stroke symptoms. Strokes often happen suddenly, and beyond the fast signs, you might also see one-sided numbness, confusion or trouble understanding others, dizziness or poor coordination, severe headache without cause, loss of senses like smell or taste, and changes in personality or memory, seizures, or even passing out. If any of these symptoms appear, call 911, even if you're unsure. 3. Stroke signs in women versus men. While men and women share most stroke symptoms, women might also experience hiccups, nausea, chest pain, fatigue, shortness of breath, and racing heartbeat. Women tend to have more severe strokes and are at slightly higher risk than men. Unfortunately, they're also more likely to be misdiagnosed, so be proactive if symptoms arise. 4. Signs of a second stroke. If you've had a stroke before, your risk for another one is higher. Warning signs are the same, but if symptoms change or shift, like worsening speech issues or weakness on the opposite side, don't dismiss them. Act fast. Risk of a second stroke is highest shortly after the first one. 5. Recognizing a mini stroke. A transient ischemic attack TIA or mini stroke causes temporary stroke symptoms that may last a few minutes to a couple of hours. A TIA is a warning that a full stroke may follow soon, so treat it as an emergency. Symptoms are similar to a full stroke, and you can use the FAST test to recognize them. Call 911, even if symptoms stop before help arrives. 6. Be prepared. Around 795,000 Americans have a stroke each year. Being ready could save a life. Know the signs and teach friends and family. Prepare children to recognize fast symptoms and call 911 if needed. Wear medical IDs if you have existing health conditions, and update your smartphone's medical info. Strokes can happen to anyone, anytime, so be fast. Watch for face drooping, arm weakness, and speech trouble. Note the time, and call 911. Thanks for watching, Sunbro. Please subscribe, like, comment, and share if you find this helpful. Come again to our next meeting, Sunbro.